I'm Vicki Liviakis. Welcome to Body Beautiful. This is the program where we talk with local professionals about the very latest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have Dr. Joseph Mele. We are talking about, officially I'm supposed to say we're talking about liposuction, but he knows so much about everything. And I do have one question for you. Welcome back to the program. First of all, doctor.
Thank you. Nice to be here.
I read something today that really kind of shocked me.
Was it the YouTube video of the truck and the car?
That was excellent, I must say, and that you walked out of it alive.
She was fine, yeah.
I was reading that we're on a recession, and yet in 2009, 10 million Americans had some form of plastic surgery.
Yes.
It just doesn't, it's incongruous. What's going on?
Well, there was a slight decrease, not as big as the economy in general, but there was about a 2% decrease in cosmetic procedures last year. The majority of what they were counting were the sort of less invasive injectables, Botox, fillers like Juvederm, Restylane and such.
So what's
and those only went down about 1%.
Is that you're feeling bad about yourself, you've lost your job, you're looking for a new one, and you just go and you do something to make you feel better about yourself?
I think it makes people feel good, and there's nothing wrong with feeling good.
All right. Well, I also read here that 74% increase in rhinoplasty nose jobs?
Yes.
Is that just the statistics, or is it just...
It's probably a little bit of aberration. I don't think it's going to be another 74% growth next year. But they do tend to go up and down. And since rhinoplasty, there aren't 400,000 people having rhinoplasty a year, the percentages can go up and down a little bit more. Okay. And I also read they're having them in Iraq. Yeah. Botox in Baghdad. Even in a war-torn area, people are taking care of business. Well, everyone likes to feel good about themselves. They want to look their best. And, when things are very stressful, whether it be economy or war, it's a nice way to do that. And the nice thing about these other procedures is they can be done in the office, they're quick, they're simple, and you don't have to spend a lot of time recovering from it. You can still do what you want to do. All right, so it's not just an American phenomenon. But in the United States, liposuction, it's the most popular? It's usually ranked in number 1 or number 2. Last year was number 2. Breast augmentation, again, is number 1. But it's close to 400,000 people a year. Okay, but we all know about the diet craze. This is no substitution for that. Absolutely not. No. Does it run sort of a parallel track to that we're just trying to get smaller? Well, we want to get smaller. The liposuction has the advantage of selectively removing fat. So even someone who's in good shape, is at their appropriate weight, may have areas that bulge and that are disproportionate to the rest of their body. And liposuction is a way to remove the fat from those specific areas. Okay, now this is a statement of the profound obvious to you, but this is not a substitution for massive weight. No, when I evaluate someone for liposuction, I really look at 4 things, and only one of them is what can be changed with the surgery. I look at their diet, I look at whether they're doing exercise, I look at if they're willing to do lifestyle changes, if that's what's gotten to a point where they're just gaining weight. My ideal patients are patients who have stable weight and stable areas that are full that we want to get rid of. So the last thing I look at really is where are the bulges, and is it something I can access? And there's a limit to how much you can actually take out, how much fat that's healthy. There is, and it's really a safety limit. When liposuction was first developed, it was done dry. That is, we just took a cannula, put it under the skin, and vacuumed out the fat. The problem with that is about half of what came out was blood. So you can only remove a liter and a half before you have to stop. It's very dangerous. The newer techniques, such as the tumescent techniques and the wet techniques, decrease the blood loss to about 1%. So it's a huge difference, from 50% down to 1%. That's really what allowed us to do larger volume liposuctions and remove areas that we can notice with our eyes. And you say tumescent and wet techniques. There are several modalities out there. There's a traditional, and then certainly dry technique, nothing's injected. The wet techniques, there's something injected that helps decrease bleeding, usually an epinephrine solution. The technique that's probably most commonly used is a super wet technique, where about 1 cc is inserted for every 1 cc we expect to remove. Tumescent, technically it's more than 2, 3, or 4, depending on whose definition. So it's less traumatic on the body? Less traumatic, makes a bigger target, makes it simpler to do. All right, we want to talk about some of the other modalities as well when you take a quick break. But for more information about Dr. Mele, you can call him directly, 925-943-6353, or you can check him out on the web at drmele.com, or follow his blog at San Francisco Plastic Surgery blog.com. We'll pick your phone calls and continue our chat about liposuction when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.